Nitakupa nini e Bwana kwa wema uliotutendea. When I was a child, I remember driving in our cream Peugeot 504 with my parents through bustling Nairobi where we lived. I would look out the window and as we passed hospitals, roads, and schools, and I would ask them, who made that? I was an incessantly curious child, irritating the hell out of many people with my questions, and I still do. And my parents would say, the government did that. I don't know if they would just say the same thing over and over because they wanted to quieten me or because they were civil servants. I grew up knowing that government drives development. It's everywhere and creating everything. That idea was reinforced in my home where I saw my parents working very hard, doing their best to contribute to their country. And I wanted to be a part of that growth. So when I grew up, I was thrilled to join the civil service. I was in awe of the potential reach of government to drive broad and deep change and believed that they could work with and for their populace. But I learned over time that there was no space for me, for my ambition, my desire, and my vision of what government could be. The processes and protocols were constricting, but more importantly, there wasn't space for me at that time, especially at more senior levels, because I was young and because I was a woman. The challenges to my value system and the personal safety was not something I was willing to endure. So after many years, I left and went to design an organization that addresses how I would have loved to be supported when I was in government. I created a place where young people, and especially women, have the space to be fully who they are and work with the government to co-shape policies and plans to drive real change. This is what the Financing Alliance for Health does. I also created this organization because the government needs to learn from us. Young people from the global south are the ones they need to learn from and share knowledge with, not just from international consultants. So we are building bridges between Ministries of Health and Finance. We are expanding the definition of who can be the drivers of change through programs like the Africa Frontline First initiative that aims to scale up to 100,000 community health workers across 10 countries by 2030. I've worked in the system, and I know that there are challenges within public sector, but we can still drive development through government in spite of those challenges. That incessant little girl in me still believes in the power of government to create deep change. Earlier, I said in a phrase in Kiswahili which means, what shall I give unto the Lord for the good done for us? Country by country, government by government, we will give for the good done for us as we learn and improve. But we need to be co-drivers in the development of our homes and not merely passengers. Won't you join us for the ride? On behalf of my board, team, government, and communities we serve, I thank you for this honor.